Permit me to start with a question. Is it normal for a pregnant woman to bleed? Stay with me, let's deal with this topic. Every vaginal bleeding in pregnancy is potentially serious and must be managed with all forms of attention. There are different categories of bleeding in pregnancy. This depends on the age of fetal viability. The age of fetal viability is the time in pregnancy in which a premature baby can survive outside the uterus. According to the World Health Organization, it is 24 weeks. In some places, it is 28 weeks. In the United States, it's 20 weeks. So, but for this particular health talk, I'm going to use 28 weeks as age of fetal viability. So the first category is bleeding from vagina before 28 weeks. It is called miscarriage. Clinically, we call it abortion. Then bleeding that occurs from after 28 weeks to before delivery of the baby is called antepartum hemorrhage. Before, partum, delivery, hemorrhage. So antepartum hemorrhage means bleeding before, delivery. Remember that there can be blood spotting, which occurs, like there are a few drops on that way, and it's so light that it wouldn't cover a panty liner. This can be due to implantation when the implantation occurs in the uterus, or it can be a sign of threatened abortion. Now, what are the causes of bleeding in pregnancy? The causes of bleeding before 28 weeks of pregnancy are either due to the pregnancy or due to other factors. Pregnancy factors will be miscarriage, ectopic pregnancy when pregnancy is outside the uterus, hydatidiform mole or what we call molar pregnancy. Other factors will be cervical lesions, cervical polyps, and also infections. Then causes of antepartum hemorrhage, that is bleeding after 28 weeks. There are two commonest causes, placenta previa and abruptio placenta. Placenta previa means that the placenta comes before the baby. That is, it is low-lying. So as the pregnancy grows after that 28 weeks, it is expected that the lower segment of the uterus also progressively expands to accommodate the growing fetus. So the placenta, which is low-lying, is sheared off as the uterus expands, and this will lead to, episode of bleeding. The exact cause of implantation of the placenta at the lower uterine segment is not known. However, there are some risk factors that have been identified. Multiparity, someone that's delivered more than 2 times or more than 3 times, increased maternal age, more than 35 years of age, previous scar in the uterus or previous surgery in the uterus, large placental size, smoking, short interpregnancy period when the interval between 2 pregnancies is less than 2 years, you're likely to have a placenta previa. Then abruptio placenta is a form of antepartum hemorrhage in which bleeding occurs due to premature separation of a normally situated placenta. So in this one, placenta is where it should be, at the upper segment, well placed. But somehow it just starts detaching, before, while the baby is still growing. So it can cause, blood for a woman to bleed. The cause is unknown, but the following factors are associated with it. Trauma. Don't hit a pregnant woman, please. Whatever she does, you don't hit her. If you hit her, the tendency that her placenta will separate and she will bleed is high. Then sudden uterine decompression. If you just decompresses the uterus, maybe she just ruptures her membrane suddenly. Then short cord. The cord is what connects the baby to the placenta. If it's very short and the baby tries to turn in the uterus, it can detach the placenta. Then hypertension and severe preeclampsia. Polyhydramnios means too much fluid inside the uterus, too much water, the water that the baby swims in. When it's too much, it can cause placenta to detach. Then of course, folic acid deficiency. Now, what are the features of bleeding? For placenta previa, it comes as a painless bleeding. Classically, placenta previa happens in such a way that you just find yourself in a pool of blood without any prior incidents. You might just wake up in midnight or early in the morning and see that you're wet, and when you look, it's you're in a pool of blood. Although in some cases it can occur following sexual intercourse. Then abruptio placenta presents with abdominal pain, and the bleeding may or may not be visible. The woman might be bleeding inside the uterus and she will not know. You just know that there is this very bad pain that she can't cope with, and a mother might complain that she has not been feeling her fetal movement, and the abdomen might be very hard. Once you feel this way, please, you have to see your skilled birth attendant for proper assessment. It's always better and safer to be too quick to act than to delay, and then you find out that all is not well. So when this happens, what do I do? The first thing is stay still and take a deep breath. Then remain still. If you're lying down, just remain lying. else, if you're not lying down, sit somewhere, then think clearly and call for help. Think of the best person that will respond immediately, but don't panic. Call the person and tell the person to come and take you to the hospital. Don't insert anything into the vagina. Instead, place a clean sanitary pad like your menstrual flow and wear it. Once help comes, the pregnant woman should be assisted calmly into the car or an ambulance, as the case may be. If an ambulance was sent from a hospital, then automatically the emergency protocol for antepartum hemorrhage has been triggered. The hospital is ready and waiting. But if it's a private transportation, a private car, once you arrive at the hospital, don't attempt to calm down. The person that took you should go first to the emergency room, the A&E room, and alert the health personnel of the case. They'll take it up from there, because every health worker understands what it means for a woman to bleed during bleed during pregnancy. So once you get to A&E, they know what to do and they'll handle it very well. Just be calm. Please note that once the patient gets to the hospital, a lot will be necessary, depending on the status of the mother and the baby. The obstetrician may decide that what the best is either to stay on admission or go for emergency cesarean section. That's conservative management or emergency cesarean section. Either way, it will require urgent blood donation, series of laboratory tests, for you to buy intravenous fluids, what we call drip. Please just have an open mind, hope for the best, prepare for the worst. Just have an open mind and be cooperative. Don't go complaining. Please just cooperate and take instructions. Once again, thank you very much for tuning in to learn. Bleeding is a serious issue. In fact, as I'm talking about it, I'm just picturing it and I'm being so calm. It's like it's happening. So please, it's a serious thing and it can be controlled. Just use the knowledge I've given you today well. Share this. You may never know how far a little act of kindness will go by sharing this video to everyone. You may be saving someone. So please, you can drop your questions and your comments in the comment section below. Thank you very much and see you again.